Good evening, everyone. Thank you for attending this meeting on the Overview and Scrutiny Committee on Thursday, the 2nd of July 2026. My name is Councillor Ellie Close and I am the chair of this meeting. When speaking, please do not obstruct your mouth to enable lip reading or the use of closed captions. We are not expecting a fire drill, so if the alarm sounds, please exit the way you came in. Please ensure that all mobile phones are switched to silent, and please could we have brief introductions around the room and then those, if any, on Teams.
Sorry, my name's Councillor Bev Murray. I'm Executive Member for Early Intervention.
Oh, I've got to use that one, sorry. Hi, I'm Councillor Margaret France. I represent Chorley North East, but I'm here tonight as an exec member for Health, Wellbeing and Partnerships.
I'm Gemma Burkett. I'm the Ledger Contract Manager for Chorley Leisure.
I'm Neil Holt and I'm Director of Finance and also Director of Chorley Leisure.
Emma Walker, Councillor for Chorley North West.
Kim Snape, Councillor for Adlington and Anderton Ward.
June Molyneux, Councillor for Adlington and Anderton Ward. Spelled wrong on that. Huh?
I'm Christine Hayden, Councillor for Eccleston, Heskin and Charnock Richard.
Russ Green, Councillor Russ Green for Buckshaw and Whittle Ward.
Councillor Gordon France. I'm a councillor for Chorley North East.
Leslie Dew Rose, Councillor for Clayton West and Curdle.
Oh, I think I took your one. Oh, it's this one. There you go. You can tell I'm a new councillor. Hi, I'm Olga Cash, councillor for Chorley South West.
Michelle Brown, councillor for Clayton West and Curedon.
Sarah Ainsworth, Councillor for Chorley North West.
Deidre Moss, Councillor for Buckshaw and Whittle.
Councillor Arjun Singh, Vice Chair and representative with Christine for Eccleston, Heskin and Charnock Richard. Thank you.
Thank you. Have we received any apologies?
Thank you, Chair. Yeah, we've received apologies from Councillor Craig Southern. Thank you.
Thank you. Item 1, declarations of any interests. All members are reminded of their responsibility to declare any pecuniary interest in respect of matters contained in this agenda. Do any members have any interest they wish to declare? No? Okay. Moving on to item 2, minutes of the last meeting of the Overview and Scrutiny Committee, which was held on Thursday, the 26th of March 2026, pages 5 to 12. Is everybody happy to agree the minutes from the last meeting? Do I have a proposer and a seconder, please? Thank you. So that is agreed as an accurate record. Item 3, minutes of the last meeting of the Overview and Scrutiny Performance Panel, which was held on Thursday, 25th of June 2026. These minutes are included in the agenda supplement. Does anyone have any questions or issues they would like to raise? No. Are members happy to agree the minutes? Pardon? Oh, sorry. Is everybody happy to note the minutes? Could I have a proposer and seconder, please? Thank you, Councillor Green. Item 4, there have been no public questions received. So we'll move on to item 5, the notice of executive decisions. The latest notice of executive decisions is available via the link on the agenda to the Council's website. Does anybody have any comments or questions? No? Is everyone happy to note the notice of executive decisions? Thank you, that is noted. Item 6, Chorley Leisure Scrutiny Update, pages 13 to 34. Councillor Beverley Murray, Executive Member for Early Intervention, will present this report. Gemma Burkett is standing in place of Jennifer Mullin, is that correct? And we've got Neil Halton, Director of Finance, who are also the directors of the Leisure Company in attendance. Could I please ask Councillor Murray to present the report?
Thank you, Chair. So when we talk about Chorley Leisure Limited, it includes All Seasons Leisure Centre, Brinscoll Pool, Clayton Green Centre and Westway. And I just wondered, Chair, would it be okay if I gave some background before I actually go into the report? Because I think it might be just interesting and help members understand where we are. Is that okay?
Yeah, please, that would be really useful.
All right, thank you. So the background to Chorley Leisure is that prior to Chorley Leisure coming into existence, the leisure centres were managed by Active Nation under a contract, and when that contract came to an end, we obviously went out to get a new provider, and we did actually secure a new provider, but then COVID arrived, and the new provider said, "Oh, we can't do this because we've got our own leisure centres to manage, and we don't want to take on any more." So at that point, the council then had to make a decision to either close the leisure centres or to bring them in-house. And at that point, we decided to bring them in-house and create Chorley Leisure Limited. But what we did find that when we came to take over was that there were a number of issues with staff and hirers and groups, and it would seem that for the last couple of months or so, Active Nation had looked not strategically but short term, so there was a lot of sort of unpicking to do with groups, which was quite challenging, and we did get quite a lot of flack for it at the time, or rather Gemma did, because she was front facing. So we have come a long way since then. So if we turn back to the report now, Chorley Leisure Limited has a workforce of around 100, 80% of which live in the borough, and it's made up of swimming teachers, specialist roles, management and leisure attendants. They are responsible for the day-to-day management, including management of facilities, delivery of swimming and fitness programmes, and it also plays a key role in supporting the wider strategic objectives. The company are responsible for ensuring facilities are maintained to an appropriate standard, the health and safety, asset management, etc. And they work with the council to deliver the capital investments such as the refurb and the decarb work, which is currently taking place. I'm aware in the past that scrutiny governance has been raised, and as a wholly owned company of Chorley Council, the organisation operates within an established governance model comprising of a board of directors and the shareholders. The board are responsible for the operational management and delivery of service, and the shareholders, which is the executive cabinet, retain strategic control, approval of the business plan and scrutiny of performance. Governance is supported by established policies and procedures aligned to the council, such as financial management, risk assessment and audit, and there is always a focus on strengthening arrangements in response to internal reviews and best practice. What we want to do is ensure that the reporting processes are embedded and the business plan is monitored. The business plan, which is attached, sets out the strategic direction, priorities and key performance indicators. And these key performance indicators provide a structured mechanism for monitoring delivery and ensuring that the company remains aligned with council priorities. Chorley Leisure has delivered strong operational performance across swimming, fitness and pay-as-you-go. There's been an increase in membership and also engagement from older residents in the borough. We've also made progress on reducing the subsidy. This is by reduced energy costs, increased income levels and a reduction in change in the staffing structure. The aim being cost neutral, which does remain a challenge. And I think we do have to be realistic moving forward, because there will be challenges about maintaining service delivery and income levels during the refurb work. And also we have to acknowledge that the ongoing subsidy will be needed to support Brinscoll swimming pool. However, there are opportunities. Once the refurb is complete, facilities will be much enhanced, so we can look to strengthen the commercial offer with parties, events, holiday camps, as well as expanding the fitness provision. And we're going to seek to maximise the value for money through a comprehensive review of services and supplies, and look to expand the provision at Brinscoll with weekend opening and specialist provision to improve accessibility for targeted groups in the community. We're also going to focus on workforce development with the establishment of new roles, including reception and sales functions. So moving forward, there is a mixture of challenges. I think we have to be realistic about that, but there's also some opportunities. And I would welcome any suggestions or comments on how we can move forward positively, and of course, any questions. Thank you, Chair.
Oh, sorry. Thank you, Councillor Murray. Does any members have any questions or comments? Councillor Hayden?
Hi Yeah, it was just about the staffing situation, and it does say that you've struggled in some areas of being able to recruit staff. And I just wondered whether there were the roles that we could possibly grow ourselves, you know, from people who actually could train with us and actually take up a role, if there was any, you know, something that we might be able to do in that area.
I'll just briefly answer that, and then I don't know if Gemma's got anything to add. But when we took over the management of them, what we decided to do was, because obviously leisure is an industry where it's not particularly well paid and the conditions aren't always great. So what we tried to do was to embed a positive culture where people have the opportunity to develop and you know, get qualifications. And in fact, 20 of our staff members have renewed or achieved further qualifications. So we are quite positive about encouraging you know, staff to, but we have had problems around swimming teachers. I don't know if you want to add.
Yeah, we do. We advertise quite a lot of trainee roles where we provide the training for people, because it expands the pool of talent that we can actually access. Just because someone doesn't have a qualification as a swim teacher doesn't mean they wouldn't be a great one. So we do offer those roles quite regularly. We do quite a lot of internal development opportunities. We do quite a lot of internal recruitment as well. And once the refurb's finished and we have the fitness team, we're hoping to look at opportunities for apprenticeships as well.
Councillor Green.
Thanks, Chair. just building on that, I was going to ask just about retention of staff. So, from my understanding, that in the past when we've trained people up, you know, they've got skilled up, and then they've gone off and been sort of like tapped up and left to go to other organisations, other sort of leisure organisations. What are you managing those that once you've trained them up? What arrangements you've got in place to try and make sure you keep those people? Because obviously there's quite a bit of investment to do that.
We have, from a practical perspective, we do a learner agreement. So there is if we're paying for qualification for an internal staff member, they do sign to say that they're going to stay for a certain amount of time, or we'll recoup the cost for that from a commercial perspective. We actually have really good retention at Chorley Leisure staff,
right, good.
Particularly within the management team. We find a lot of the front-facing roles like lifeguards and that sort of thing, they tend to be students, because the hours are a good match because they're evenings and weekends, so they do tend to naturally churn when they go to uni or go to do their career once they finish the degree. But certainly from that level up, sort of duty manager upwards, we've got incredibly good retention. We, as Councillor Murray said, like leisure is often a poorly paid industry, but actually because we're on council terms and conditions, it's incredibly well paid at Chorley and South Ribble Leisure for the jobs that we do. So that is an attraction in itself. But then obviously we try to add value through the staff enjoying what they do and just feeling like they're part of the team and being able to submit their own views and being listened to. So
you've found your retention is good because of all those arrangements, right? Okay, good.
Yeah, people don't leave often. Like I said, if they've got if leisure isn't their forever career, they'll move on when they've got the qualifications. But any that are kind of in it for the long haul tend to stay with Chorley Leisure because they see it as a good employer. So we're really sort of proud of that.
And then the other question I've got is in terms of, with Margaret being here as well, just in terms of links to are you exploring, or have you explored links to other sort of wellbeing initiatives to try and push people into use of Chorley Leisure Centre and swim baths and stuff around the borough?
Yeah, well, Margaret organised the Health Mela down at All Seasons. But what we're hoping to do up at Brinscoll is, because of the way that Brinscoll is built, you can sort of block it off for a single use. So we're looking at using some sort of groups that would struggle perhaps to go into All Seasons because it's loud and you know. So we're going to approach sort of domestic violence charities to see if they can utilise the space, as well as, you know, children and adults with autism, because it's just too loud. So we are looking to sort of feed into other themes that the council provide. Women only swimming, and you know, things like that. And looking at the better health, better self. Obviously, people go on that, and sometimes they could perhaps a little bit self-conscious. So we're looking at perhaps saying to them, well, have you thought about going to Brinscoll, because it's quieter and there's more opportunity for you to just, you know, swim without the noise and the kids and everything else running around.
I do just on. I was in Gordon, Margaret, quite pleased to hear this. For me, I think Brinscoll's a superb little bath. My kids went to Brinscoll St John's and used to walk down the road and go swimming there. And sometimes I sometimes wonder, like, you know, and we say that, you know, we'd have to to subsidise it, but I don't know. Sometimes I feel like, how much do we put on actually, the cost of actually kids learning to swim and potentially save, that saves them lives as well. What cost can you put on that? To me, I think it's money well spent, and also because you can do other things with Brindle being a lovely, like, sort of a calming place to go. So I do think it's an actual fantastic place. So from my point of view, even though you might need to subsidise it, I do think actually all the other costs it brings to the local community as well, I think it adds a lot of value. So that's just my little plea for Brindle Bass. It's a fantastic little place. And one of the last one is just in terms of like, have we thought about sort of doing discount schemes for sort of like elderly or certain times of day when it's not used, to be able to get certain groups in to be able to use it?
We do have a scheme for veterans, and obviously when we do the refurb, then we're going to have to look at how we market it and what we do, because obviously some existing members will have gone through all the sort of pain and disruption of being a member, and then we've got new members coming on board. So it's something that we do constantly review to look at, because you are right, what we want ultimately is accessible, good quality leisure facilities. So things like that are reviewed, quite often. Yeah,
good. Thanks, Bev. Thanks, Chair.
Thank you. Councillor Hayden?
Yeah, I just wanted to say how pleased I am that Chorley, over all the years where we've had constantly monies taken away from us by central government, that we've been able to generate funds to be able to keep all our leisure facilities open. So congratulations to everybody involved in that. I think it's brilliant. And a question, please, about the numbers that you've got in paragraph 18 about how many user groups and how they've increased. Now, it doesn't give a breakdown of the groups, by age or whatever, so we're not sure what we're talking about numbers-wise, but the over 65s is a 37% increase, and that's quite large, isn't it? So it would be useful to know, what have you been doing to encourage these people, and how many is it in real terms? If there's only 2 going already and you've increased it by 37, there might be 3 going now, but
don't look at me when you say that.
Thank you.
I don't know the exact numbers, but I'll write it down and I'll send them over to you. It's not 3, I promise. The stuff that we've really kind of lent into with our 65 plus demographic is to try and target sort of like isolation and loneliness, and try and really lean into the social aspect. So we've tried to start creating that demographic really enjoys sort of group activities. So we've really tried to lean into the social aspect. So we've added new classes to the timetable, like circuits and social, rackets and social, spin and social. And so essentially they do the class, but then we put some time aside for them afterwards to get a cup of tea, they sit down, have a chat, we do biscuits, stuff like that as well. And that has just gone through the roof. And so we've tried to lean into that a little bit more. Also just finding out a little bit more about what they would like to see, rather than making assumptions ourselves as to what activities people might like. And I think I've been in leisure for nearly 20 years now, and what that age demographic liked when I first started and what they like now, they're a younger 65 than they were 20 years ago. So we definitely need to lean more into like finding out what do they want to do. Yoga and Pilates is another big one, so being able to add more of that to the timetable has really helped. But certainly leading into the social side of things has really made a huge difference for us. We realised it after COVID, when people came back, one of the main things they loved about coming back from that age group was that they got to see their friends again, that they saw every day coming swimming, and they'd miss them so much. So it was really nice to be able to do a bit more of that.
Covering the business case here as well in this bit. I was just a bit surprised at your targets on the risks, and mostly they're amber. And there's a lot of them are rated as amber, and your target rating is still amber. And I wondered why it didn't seem to be a bit more punchy, in trying to get a better thing going to green rather than amber.
Yeah, so these are the risk ratings. So how the numbers are calculated is the likelihood of a risk happening versus the impact if it does happen. And the impact of what happens if something does happen will never change, even if you bring the likelihood down to almost 0. Yeah. So if there is one where the target and the actual are the same, it's because it's the lowest we can possibly get it. So there's 2 8s on there, for example. That could be that actually the likelihood is very unlikely, but the severity is major. which would be a 2 times a 4, which makes it an 8. So if they are the same, it's that we cannot possibly get it any lower, because the impact will always be severe no matter how unlikely it is.
Okay, that's great. Thank you. Thank you.
Thank you, Councillor Singh.
Thank you for the report. Just a question. Based off page 16, we can see the 9% annual increase, which is great, and total membership has reached over 4,400 people. Given that summer holidays are coming, children will need something to do, parents will want to do activities with their children, etc. Is there some sort of initiative, or is there some sort of, I don't know, offers or something going on for parents and children that way?
Thank you, Chair. So we put fun swims on during the school holidays, both half-term Easter and the summer holidays. And moving forward, as it says in the report, we are hopefully going to look at doing some sort of holiday camps, which we used to do under Active Nation, but obviously because of COVID and then trying to get back on track with everything. But that is one thing that we will be looking to do moving forward.
Councillor Brown, please.
Thank you. Firstly, what a fantastic report. So well done to all of you. There's some really good news in there, and I agree with Councillor Hayden about the investment in continuing that within Chorley. It's fantastic. I've got a few questions, though. So the first one is about, we talk about the utilisation rates and the improvements that have been made, but what it doesn't tell me is what that is between the 4 sites and whether we're seeing that improvement across the 4. Or I know when Councillor Murray gave me a nice tour of Clayton Green a while back, there were concerns about the utilisation rates in Clayton Green, and I note there's a bit of a differential on investment as well across the 4. So first question is, what does that look like for the 4, and have we got improvements to have in some of the other areas?
Yeah, so they are 4 very different sites. They've all got their own personalities. Yeah, so the bulk of the investment is at All Seasons. We did have a feasibility study done a few years ago to assess the viability of investment in the centres and what sort of return we could expect from that, not just from income, but from how much would it impact participation. And All Seasons was the outlier, was the by far and away, it was the sort of king of that report. The opportunities there that are untapped are substantial. And the more money that site makes, the more can be reinvested in the other 3 sites. So at the moment, that is the current plan. Westway is a fairly new site. It's only 4 years old, so it doesn't really need any investment. Brintskill had significant investment a few years ago, where essentially it was practically rebuilt, and it's undergoing decarb works at the moment. And there is discussions ongoing around investment in Clayton to be able to bring some of those elements up to standard as well. But at the moment, the vast majority of the investment is going into All Seasons.
Thank you, and I recognise the reasons for that as well. I do wonder about, because we talk about NEETs and the issue, and obviously Clayton West is highlighting as one of the areas where NEETs is a particular problem, and we've got a sports centre there, and I do, with the utilisation problem, I just wonder if there's something more that we can do to try and triangulate to help some of those. I don't know, but Councillor Murray's looking at me, so I'm not sure. That wasn't one of my questions, but it is now. Thank you. On paragraph 25, we talk about the health and safety audit score ranging from 88% to 94%. I can't glean from that although it says remains, whether that's an improving score or if any of those are actually reducing.
No, they've all gone up. We've got a very passionate and proud facilities manager who leads on these audits, and every year he's chasing a higher score. So yeah, they've gone up. The 94 is the highest one he's had so far. That was for Westway.
Excellent, that's the right answer. Thank you very much. The key projects. So we've got a risk register that's RAG rated, but the key projects aren't. And I know most of them are only starting in April 26. Are there any of those that the committee should be aware of that are at risk now, as we are at the end? Are we in July now? We're in July, aren't we? Now that we're 3 months in, because it's not showing, we're not RAG rating the key projects.
No, nothing at the moment. They're all sort of planned in for various points in the year. The big ones that would be a massive red flag if they weren't progressing will be the decarb and the refurbishment. They're not technically leisure projects, but leisure obviously playing a big part in supporting the development of those, and they are on track. Yeah. Everything else is operational is being picked up, but there's nothing of concern.
Excellent, brilliant. And final question, the red on the RAG rating for the risks is around GDPR. I'm just wondering, is that a security or a training issue, or what's driving that to be a red?
Yeah, so GDPR is, it's not like day to day we've got major issues, it's the underlying sort of like framework for that, and it is a council-wide issue, and I believe that support has been... Yeah, Neil can take this.
I think this has been discussed as well at Audit and Governance Committee, and it is a risk for the council. We have commissioned an external provider to do a kind of an assessment of where we are GDPR-wise. I believe that may have come back or is imminently coming back, and I think that is really, it's a framework for us then to go, right, we know where we need to address. So I don't, as Gemma says, I don't think it's about day-to-day issues, that risk. I think it's our concern about drawing the boundaries around those issues, and it is council-wide as well.
Yeah, okay, that makes sense, and yes, we have discussed it in audit as well. I think it's really important that we are honest about that, so it's good to see it actually. We know what we're aiming for, so no, thank you very much for that.
Councillor Green.
Thanks, Chair. I just want to come back on something that Christine mentioned about the way that you've had a massive increase in uptake on sort of people over 65 cutting, and you mentioned all those sort of things you've done. Just want to, in terms of reporting stuff, you know, to the committee in future, that we provide a bit more of that detail, because throughout when I'm engaging with local residents, you know, some of the more the elderly side of things, I could go, do you know what? Actually, there's been a key initiative to do X, Y, and Z. And do you know they're doing this and doing that and doing that? And so as a councillor, then I could help sell that benefit to some of the residents. So I think sometimes, you know, when everything's all good, and we don't probably overdo it, and we're focusing on stuff that when it's going, you know, a bit red or whatever. I think something like that, when you've had a really positive thing, I think it'd be worth putting a bit more granularity in, so that we can then take it and use it for, you know, selling purposes. To use your councillors to do a bit of selling. So just something going forward on that, where you know, put a positive, really positive initiatives, and really put work out whether we could have a bit more background on how, you know, why it was such a positive thing, what went well, and then we can push that message out to our public. So thanks, Chair.
Thank you. Councillor Singh.
Just a quick one, just building off Councillor Brown's comment there about the GDPR. Once we know a bit more, can we get a bit of a report back, an email back or something to the members in relation to obviously Chorley Leisure, how that's impacted there, if that's okay?
Yeah, yes, I think that's not an issue. I will come back through Audit and Governance Committee as well, but absolutely we can respond on where we're at with that.
Thank you. Has anyone got any further comments or questions? Sorry, Councillor France.
Sorry, I just wanted to commend what other members have said about the financial support for Brinscall Baths. It is an old building. I believe it's one of the oldest continuously in use swimming pools in the country. It would have been a lot easier and possibly made financial sense a couple of years ago to have closed it down. But the money that's been spent on modernising it and currently on the decarbonisation is greatly appreciated, and residents are looking forward to the extended weekend opening hours. It will be a huge benefit to the villages of Chorley North East, where we don't really have any other community buildings other than Brinscall Baths. So it is well used, and it's taught generations of people to swim down the years. So a huge thanks to Chorley Council really for continuing to support it. And as we go into LGR, let's hope that continues. From the health and wellbeing point of view, exercise in general across our residents is vitally important in terms of their not just the physical health, but the mental health and the economic ability to perform as members of the community. Thanks.
Thank you. So thank you again to the executive members and the officers for their attendance. Are there any further recommendations that members would like to note? No. Is everyone happy to then note the report? Thank you, that's noted. If any members or officers would like to leave, please now do so. Don't feel like you need to stay for the rest of the meeting. Thank you. Let's move on to item 7, which is the update from the representative on the LCC Health and Adult Social Care Overview and Scrutiny Committee. Councillor Margaret France will give the verbal update on recent meetings on the committee. Could Councillor France please now present her report?
Thank you very much, Chair, and I'll be hopefully able to also slip out at the end of these two reports, as I have another meeting to attend. But yeah, so there are 3 meetings of the Health Scrutiny Committee, or to give it its full title, the Health and Adult Services Committee of Lancashire County Council, which have been since the last time I attended Overview and Scrutiny. They are on the 4th of March, the 22nd of April, and on the 17th of June. And I'm ashamed to say that I wasn't able to attend the 17th of June. I was in Botswana at the time, and sadly also my deputy was also unavailable to attend. But that particular meeting was only and solely for the setting of the agenda for the 12 months topics of discussion in the year ahead. So there are no papers for that meeting that I can refer to, and it was a meeting in private, so so be it. But so I'm happy to report the 4th of March and the 22nd of April, but for members to note that these meetings occur about every 6 weeks. They tend to last between 2.5 and 3 hours. They're extremely long, so I do my best to summarise them in a way that will be meaningful but still have some information within it. But I am happy to take any questions and come back to individual members if they've got particular questions. I cannot say in all honesty that I can remember every minute of those long meetings, but I'm happy to look into any questions. So the first one, the 4th of March. Now there was one really substantive item on this meeting, and that was the Neighbourhood Health Development Plan for Lancashire. This was presented by Dr. Sakthi Karanithi, who is the Public Health Director for Lancashire, together with officers from across health and social care. So he introduced the agenda by talking about the NHS 10-year plan and the 3 tenets of that plan, which are prevention before treatment, hospital to community, analogue to digital. And discussed how NHS neighbourhoods are developing in order to address the wider determinants. But in reality, there's a lot of guidance that people are awaiting to come down nationally from Westminster about how this is going to evolve. He went on to talk about a major workshop across multidisciplinary teams that was held earlier in the year with questions like, what is a neighbourhood and what are the priority outcomes? What is the scope of the services and how will they delivered together? How is the governance and accountability going to be measured? How do we coordinate at district level first? There was an agreement that the ideal footprint for a neighbourhood would be at the order of 30,000 people. And then what are the outcomes that neighbourhood working is working towards? So it's a huge piece of work, and it really is in its infancy. The feeling was that the existing ICB priorities of starting well, living well, working well, ageing well and dying well, that those people who move in health circles will be well familiar with. They've not really been changed in the last year or two. So there's a lot of work to be done there. There are pilots currently working on this, of which Blackburn and Darwin is one, and Morecambe Bay is another one. And they will report on their success, or be that as it may, to the Health and Wellbeing Board, that in turn will report down to the district health and wellbeing boards. So it's a process in its infancy, in essence. There's a lot of unknowns. There's a lot of stuff needed to come down from central government to give us some sort of idea of what is expected of neighbourhood health. So we're in the early stages. It will continue to be reported at intervals, and that's really all I can say about it. Chorley did apply to be a pilot, wasn't successful, but I believe together with South Ribble are working towards some of the issues that within the area of the pilots. So it'll be interesting to see whether there's any success in that regard. I have to say, as someone with a 30-odd year experience of working in the NHS, any sort of reorganisation structure fills me with dread, having lived through so many of them. So in neighbourhood teams, it sounds wonderful in its concept, but we shall see. We shall see. The second thing on this same subject really was to talk about the Winter 25-26 collaborations which occurred between health, adult social care and the community sector. And this looks at the experience of 25-26 together with the idea of reporting back to Health Scrutiny in October 26 with the lessons learned and the plan for 26 and 27. So, in last winter, you're probably aware that all NHS trusts across Lancashire and South Cumbria were declared at OPL4 at some point over the winter time. So new ways of working are vitally important, really, to try and prevent these huge snarl-ups in hospital emergency departments or due to winter pressures. So they talked about new ways of working, about putting social workers in the emergency department, having access to step-down beds, and having a BCSE approach to non-complex discharges. So organisations like Age UK are very good at helping, so facilitating discharges by going into people's homes, putting the heating on, making sure there's food in the fridge. They do an awful lot of good work together with the discharge teams. So I look forward to their report back in October to see what the designs are for winter 26-27. Now, the meeting of the 22nd of April, again, there were two largish items. Firstly, the Community Mental Health Transformation Update. So the Community Mental Health Transformation Programme was nationally mandated by NHS England in 2023 to promote mental and physical health, effective care and treatment, preventing of ill health, improving quality of life, and working collaboratively across statutory and non-statutory organisations, and the model of care to be based on inclusivity. So there were a lot of very worthwhile targets there, worthwhile things to focus on. So far, Lancashire South Cumbria Foundation Trust have created 4 community mental health integrated teams across central Lancashire. That includes Greater Preston, North East and Preston, Chorley and South Ribble and West Lancs. And they were set up in October 2023. So several work streams have supported co-production with voluntary community sector and the ICB. There are now place-based hubs focused around primary care networks and mental health integrated neighbourhood teams. There's co-location of health and social care teams, drop-in sessions in family hubs, homeless centres and domestic abuse services, and work on data sharing and communication for joint working. So I think there have been some positive things come out of this. We're having enhanced multidisciplinary teams with district-based virtual hubs. I found this quite interesting. So these virtual hubs are described as a team of teams, including health, social care, peer support and wider system partners like housing and DWP, to be a wraparound the person type of support. It will include accommodation pathways and options and employment support. Preventative and early intervention commissioned by the ICB, again using voluntary community sector. Learning disability inpatient facility has recently opened. You may have seen this at the unit called Water Meadow View at the Old Whittingham Hospital site. Is a very welcome addition to facilities for people with learning disability. And I was happy to see that finally there is some attention to co-occurring conditions, because for many, many years in mental health services, anyone with a problem of addiction or substance abuse was shown the door. You either had a mental health issue or you had an addiction issue, and you weren't allowed to have both. So those poor people were bounced around from pillar to post. They went to one and they were sent to another. And it really was a dreadfully unsatisfactory system. And I'm happy to say that finally seems to be being addressed. That the idea of somebody having more than one condition seems to be finally someone's taking notice of. So I found that quite interesting. There was a peer challenge by the local government association on the new community mental health, of which there were 34 actions. 17 of them have been completed satisfactorily, and the other 17 are active and progressing. So it's encouraging, work's going ahead, and one would hope that the provision of mental health in the community across Lancashire is the better for it. And the final thing I want to talk about, again at the April meeting, was to do with the Lancashire Constabulary. So this is a project called Right Care, Right Person, and it refers to the police's action when they receive a concern for welfare. And these things are quite a common occurrence to some extent. There's something like 35,000 concern for safety or collapse, stroke, illness reports that are received by the police in any given year. So the idea, I think, is that the police want to make sure that their response is proportionate, it's in compliance with their legal duties, and that they're signposting to the most appropriate agency, which might not necessarily be the police, but might be medical or psychiatric. So when that call's received at the call centre, the decisions whether or not to attend are based on risk and not resource allocation. They use something called a National Framework PASS system, which stands for Public Assistance and Service Standards. And in that system, there are 5 possible outcomes. If emergency response is required, that's within 15 minutes. So that's when someone's life is in danger. A priority will be responded to within an hour, routine within 8 hours, standard within 48 hours, and some will be resolved over the telephone, I guess when other agencies are brought in. So as I said, there's 35,000 of these calls every year. 63% result in deployment, 37% non-deployment. And at that point, usually the call is escalated to supervisors by the call handlers to discuss the correct management of that call. Since the introduction of 2022 of the Right Care, Right Person programme, there have been no formal notices to the constabulary relating to its implementation. So work is ongoing to support vulnerable people. I was happy to see the street triage teams, who are trained police officers and mental health professionals working together, extended hours available by these teams. So they work within crisis response and prevention, and as a last resort, Section 136 of the Mental Health Act can be used only to protect life, and this will result in compulsory detention for the person concerned for a period up to 72 hours. Okay, thank you.
Thank you, Councillor France. Does anybody have any comments or questions? Councillor Cash?
Thank you, Chair. Thank you, Councillor France, for a very broad report, and I'm learning, and my question comes from that point of view. My understanding is that the Care Quality Commission is quite worrying in its reports about the situation of vulnerable adults, and that scrutiny of adult social care could be stronger. So my query is around how it works in that scrutiny here at Chorley. Do we receive regular and detailed reports to make sure that the adult social care is doing its job?
I can say, Councillor Cash, that the health scrutiny meetings are open to anyone, so anyone with a particular interest is able to go and watch them, be present at the meeting, or if you wish to submit questions in advance to the chair, that also can be done. They're also available to watch on Lancashire County Council's website. But yeah, I share your concerns about adult social care in general. We know this is a very difficult area for Lancashire. It's a huge cost to Lancashire, and I think recent reports have not been very favourable in a lot of ways, not just in adult social care, but there are lots of other issues I think that are causing concern, like children's services. So there's a lot of work to be undertaken. I have to say I think that we're moving in the right direction finally, but time will tell. It's difficult to recruit people in adult social care. The rate of pay is very poor. People take on a large responsibility caring for people who are vulnerable and elderly with very little financial reward. And we'll all know from our own lives stories about people who've had carers coming in, who come in, turn around and walk out again, because by the time it's taken them to drive to the call, leaves them with virtually no time to spend with the client that they're supposed to be helping. And that's particularly applicable in rural communities, where they may have a 10-minute journey time there and back and a 30-minute slot. So I think there are major problems with health and adult social care, and they're not going to go away because of the demographics of an ageing population. And unfortunately, there isn't really a magic wand to wave. Sorry, I'm being very depressing, aren't I?
May I ask another question?
Yes, go ahead.
Yeah, I think I'm still on. I think you would expect me to ask something like this. Is there a mechanism, and it may be something we could discuss outside, that where providers can be incentivised around the environmental impact? Is that something that we do, sort of using electric vehicles, have care homes providing environmental impact assessments? Is that something that has become standard?
I'm not aware of any moves to actually put that on the agenda because, as I say, I think finances are very tight. I hear what you're saying, and I think that, you know, as we've seen in Chorley, we're talking about our leisure centres and the decarbonisation programme is fantastic. But imagine doing that across all our hospitals and care homes. I think you'd need a very large chequebook.
Thank you. Thank you. Councillor Hayden?
Thank you. Margaret, there was couple of meetings ago, I think, the county were looking at whether AI could play a part in the care system and to improve productivity and improve the costs. Is there any work being done on that? Do you know of anything that they've covered?
I think that meeting was all about using modern technology, so things like these mats that tell you when somebody's fallen out of bed, and call systems where you can speak to somebody on the phone, check they're all right, or somebody can download a heart rate or an ECG thing down a telephone. But I've got issues about those in a way, insofar as I'm sorry, I'm terribly old school. I think there's nothing better than eyeballing a person to see whether they're well or not. The technology's all very well, but can we really believe it? If somebody's fallen out of bed onto a mat that tells you they've fallen out of bed, that's great, but what if they fall on the other side? I do have concerns about them. Connectivity is a big issue in rural areas. The internet is pretty poor, so if you're going to rely on things with internet connections, they're going to fail. But yeah, there's an agenda to pursue that route, yes, definitely.
It'd be nice if we could, if there's anything to report, you'll bring it for us, wouldn't you?
I'll keep my eyes open for anything in that regard. Thank you, Christine.
Thank you, Chair.
Councillor Brown?
Thank you. I'll start with Councillor Cash's question on the NHS and decarbonisation. So each NHS trust has a published green plan, and they're all working to the 2030 reduction targets, and it's measured annually and audited. So if you look on each website, there is on there. Obviously, smaller providers, I don't know, but NHS Trust do have had to legally do that for a number of years. It's good to see winter planning starting June-ish. Yeah. There's obviously a risk with step-down beds, and some of the plans that you've mentioned there are things that have been tried and tested, and we still end up with a problem in December, January. Because if you put step-down beds in, it only works if you've got an infrastructure around that to get the patients out. Otherwise, it gives you a month and then you've blocked a load more beds again because you can't get them out. And I do wonder how well health is working now with local authorities, with other agencies, to provide that wraparound, some of what you've talked about there. We know that there's not a definition of what a neighbourhood is now. So we're still very much talking about what it should look like, but getting it done is still, I think, quite difficult. But it does sound like it's the same thing that we're talking about. And it only buys you time, it doesn't buy you anything else, which I think is something that the health really does need to grasp and work together with people. Mental health one, it's good to see that focus and investment, but we know that our baseline is so low now because services have been underfunded for such a long time. We know that mental health is a crisis that we're facing now, and indeed we're going to start talking about it in the next part of the agenda. I do wonder how long it's going to take. I think it needs to be faster and quicker, really, for those services to have any impact on our residents. But thank you for the report.
I share your concern, and as with all of these things, usually more is expected with the same amount of money. There's not usually an injection of cash to allow these things to happen. It's usually get on with it and do the day job too, isn't it? Yeah, thank you.
Thank you. Councillor Green, please.
Thanks, Chair. Thanks for the report, Margaret. Just from my, just trying to get my head around things in terms of where the responsibilities lie with Chorley Council as well. So a lot of stuff you report on there, I think virtually all of it is effectively doesn't fall within Chorley's boundaries. So, we're prodding here, asking about questions that were outside our control. From some things you've mentioned there, I know we've done quite a lot. I keep on saying I've gone a bit above and beyond on stuff, and stuff you've done with your early intervention. Were there any key points out there where actually we're trying to fill the gaps, or trying to was there any just thinking key highlights, and maybe in future ones where some highlights of some of the say, well, Lancashire doing this, but this is where we're trying to fill that gap, or this is a key area for us and we're trying to do that. So just thinking, have you got any pointers or any key parts initiatives that we're doing in terms of relation to fill some of those gaps? That's it's a big question, so don't probably, if it's,
I think Charlie does really well because of the lines of communication that we have between housing and council and primary care networks and certainly the VCF groups. We have good links with fire service and police, all of whom are often involved in people who are vulnerable and kind of on the edge and living, perhaps in debt and poverty and what have you. The relationships that we've built up over the years through the group called Pivot, I can never remember what Pivot stands for, but anyway, it's immaterial, where people come together and discuss individual cases, has been really, really helpful, I think, in we know what each other's role is, and that, we can discuss if there are people in particular problems, we can talk about that. And Age UK come to us and tell us what they're doing in terms of their discharge support, for instance. I've mentioned to you about they go in the home, they put the heating on, they make sure there's food in the fridge, they'll bring people home from the hospital. Things like that, they're really good, that we're kind of in touch with. And we were talking about the community mental health. Through the Pivot team, we've got a representative from community mental health on board with that team, which often looks at issues related to mental health like hoarding and that sort of thing. So I think we've got a really good sound basis of good relationships and sharing information that I don't think other districts have, and I think that will stand us in good stead.
Is there any threats to those relationships breaking down in terms of support funding and that to enable you to keep those engagements going?
I'm being careful what I say here, but we don't often have attendance by Lancashire County Council's social services. They don't always come to listen to the cases that they're heavily involved in, and that is a concern. But we do try and promote, if they can't be there physically, to be online or to send a report in. So yeah, we're working on it. But I do accept that these are people with an enormous workload and they can't be in every place at once. Yeah.
Do you feel like you've got support from the Chorley Council side of things and the resources, both personnel and money available to keep those engaged? Because it sounds like it's really important that we get all that feedback and that gets fed back to the police, and then they can advocate on our behalf, and same for other organisations. So that seems like quite a key thing we need to maintain, I think, within
I
Chorley.
do think Chorley Council kicks above its weight in terms of health and social care. One easy example is the disability benefit, sorry, what am I trying to say? The adaptations, Disabled Facilities Grant, thank you, DFG. That takes so long. It's a grant that people can apply for through Lancashire County Council via occupational therapy. It takes so long that by the time you've got that access to the grant, the person it's for is usually dead. Well, perhaps not quite that, but so Chorley implemented their own non-means tested Chorley grant, whereby if you need a single large item, which can be a through floor lift or a stair lift or a downstairs accessible toilet, they'll just go ahead and do it. And that's been a huge benefit to the residents of Chorley, because it's speeded things up so quickly. So, that's just an example of how I think it is a forward-thinking council.
Thank you again for your report, Councillor France. The committee welcomes the update on the work of the LCC Health and Adult Social Care Overview and Scrutiny Committee. Are our members happy to note the report? That is noted, thank you. We'll now move on to item 8, Suicide, Bereavement and Prevention Task Group Recommendations Update, again with Councillor France. So if Councillor France would like to present this report, please.
So yeah, I'm very happy to present this report, because once again I think this is where Chorley goes above and beyond. There is only Lancaster across the Lancashire 14 who also have a suicide group, and we are not the highest incidence of suicide by any means. There are, I think, 5 borough councillors ahead of us. Just bear with me 1 second. Yeah. So, suicide prevention is largely a county, seen to be a county function. There is a Lancashire Suicide Reduction Action Plan. If you look at the data across Lancashire, the latest set of data we have, unfortunately, is for the 3 years between 2022 and 2024. And we're always looking back on these data. Some of the reason is they say that it takes time after death for there to be a coroner's inquest and the cause of death to be ascertained. So you're always looking back at a period gone by, unfortunately. But that's the most recent set of data. So the Lancashire suicide rate, this is per 100,000 residents, is 14.3, which is exactly the same as Chorley's. If you look at the name and shame list, Pendle is at the top at 18.3, Burnley is 17.8, Lancaster 17.7, Blackpool is 17.1, and Preston is 16.4. So Chorley's is about the same as the average across Lancashire. But interestingly, Lancashire's been above the England average since 2006. So for 20 years, more people in Lancashire have committed suicide than across the rest of England. In Chorley, males are the most likely group to commit suicide, particularly between the ages of 50 to 54. So you better be careful, Russ. I don't know whether you've got to that age. Females between 45 and 49. But great predominance of males, 26.8 per 100,000. So we know that there are associations, veterans coming out of the army, with poverty, with debt, with alcohol, drug abuse, with domestic violence, to name but a few. So it is a major concern. And I'm here to present the result of the recommendations from the Overview and Scrutiny Task Group. And I think they're really quite something. So there were 12 recommendations. And as you will see, we have made progress with a lot of them. It was great to see the Healthy Minds Day that we held last year. There was a full day event in the Lancastrian Suite, but there were pop-up events all around Chorley, talking about suicide prevention and about mental health issues. They went down really well. One of the best ones was at Chorley Football Club, and they were really, really motivated. And as a result, they've set up a group there where they have regular football sessions. So on the whole, I think we're doing rather well. With, if you look at the actions that are on there, out of all of those, there's progress being made. We can always do more. Do you know, I forgot to put my orange badge on. We had such a lot of members training. I look around the room and think some of you came to it, but we had the one with the Samaritans talking about having conversations with people contemplating suicide. We had the orange badge training, and it was really good to see that. And I think the fact that we've offered free training courses to people who regularly have conversations with the public who might be in possession of some information that they don't know how to handle. So your publicans, your taxi drivers, your barbers, your hairdressers, your nail salons, wherever people have conversations with people who may not be at their best. I think it's a really good thing, that. Some of the actions in here are beyond our control. There's something called bags for strife that you might have heard of. That the police have got an unenviable job in going to visit a person's family to tell them that their loved one has committed suicide. And these bags for strife were put together that they could leave when they went, for the people to look at in their own time, and they were where to get help, what sort of help's available. And simple things like a mug and a sachet of hot chocolate. Do you know what I mean? It's just to make people perhaps think that they weren't just alone and there was help out there. So the police have been a bit reluctant to carry them in the vehicles and give them out because they say they've not got a room in the van or whatever it is. But we are really pushing and working with them, and the police are on now, represented on the suicide prevention group. So hopefully we can eventually persuade them that they could do a bit more. Okay, so it's a really good report. I'm very grateful to the officers for putting this together, and you know, I think we will continue to do what we can. This is there will be further updates at a later date, which I'll be bringing to you. But it will be a while before we can hope to see any improvement in the statistics, I'm afraid, because of the fact that we're always looking down the retrospective scope. Thank you.
Thank you, Councillor France. Does anyone have any comments or questions? Councillor Walker.
Thanks, Chair. And thank you, Councillor France. It's clear you've done a lot of work on this, and a lot of work's gone into the recommendation. I just note that having a look through, sort of no mention to any sort of work around domestic abuse-related suicides or domestic homicide reviews. I just wonder if these conversations with LCC Public Health or the Constabulary or the Foundation Trust, if anything, regarding figures for Chorley or any support that we can do as a council to support victims of this, if that came up in any sort of conversations.
Part of the Healthy Minds week that we had.
Thank you. Councillor Cash?
Thank you, Chair. I was really interested in that Healthy Minds initiative and the Healthy Minds Charter. Is there a list anywhere where we can see who's signed up for that charter?
It's very difficult to keep.
Yes.
It's very difficult to keep it up to date because people drift in and drift out of it. But I'll ask the town centre team if they've got it, because I think mostly the work was done within the town centre, within the licensed premises there and the like. So there probably is some data somewhere, but I've not got it at my fingertips, I'm sorry.
Of course. Thank you.
Thank you. Councillor Brown?
Thank you. A really important piece of work, this, and thank you for the update. I do note the correlation there of the stats that you gave across Lancashire, and deprivation are quite stark, aren't they, across East Lancashire and Blackpool. There is a definite correlation there when you look at that data. It's really sad. I just wonder, in terms of this agenda, I think it's the second or third point, talks about working with partners and LSCFT in particular, and if there's any comment about how that engagement's been with them. So obviously they're under a lot of pressure, and I think Chorley is quite forward in this and really wanting to tackle the issue, and are we getting the support that we need from other services out there and partners?
I honestly can't answer that question because I wasn't involved within the task group. But as I say, I think a small positive has been the fact that we've got somebody from the community mental health team in our pivot groups now. So it's all about building up the relationships and having open those lines of communication, really, isn't it? But in terms of suicide prevention, it's you can't deal with the root causes unless you improve people's standards of living, you know, because as you rightly say, you look at where the incidence is higher. And I think this is really a personal view, but I think Chorley perhaps suffers from the fact that we have major motorway networks intersecting across the town and also the rail system. So it's easy, isn't it, in Chorley? There are lots of motorway bridges. We've been trying to persuade Lancashire County Council Highways to allow us to put more signs on motorway bridges. You know, you may have seen the Samaritan signs on other areas. They're not always very keen, shall I say. But, you know, maybe that's one way forward, because railway lines and motorway bridges are very accessible to most of our population.
I 100% agree with that, and it does feel, well, we know from the motorway networks how often there is a threat to someone's life, and the motorway networks, so you see it it's quite regular around this area, and you do wonder if there's something we could do about just the tops of them to stop that happening. So when I lived in Lille in France, all of their subway network, they don't have suicides on that line at all, and it's because when you go into when the doors open for the trams when they come in, it aligns with the platform. So the two doors open at the same time, that you can't jump onto the tracks from it. And that was in 1997, it's quite a while ago. So others have really managed this, and I do think there's something we need to learn from that. And then just one other point from me, and it's no disrespect to anybody, but because the term committed suicide is quite a common way to describe it, but it comes from the fact that suicide used to be illegal, and that's where the term committed suicide comes from. And it's more now sort of reflected to use the term death by suicide or took one's life. And I just wonder if there's something as a council we need to think about that for.
You're absolutely right, Michelle, and I was at that training too. So I'm sorry I slipped back into the old usage. It's still in common parlance, isn't it? Thanks.
Councillor Hayden?
Just to comment about the causes of suicide. I work as a volunteer with Samaritans, and there's not two people have the same issue. it's such a broad things that people have to put up with, you know, and what makes them feel so low and that. There isn't a magic pill, you know, you try and stopping them is good, but you know, to actually correct why people feel like they do, it's a load of social interactions, it's the services that they can't get, mental health services, doctors' treatment, you know, I mean, it's just a whole raft of issues that have gone wrong over the last number of years, and it just seems to be kind of like bubbling up for people, you know, and it's really quite amazing how, you know, how people feel, and like I said, there's not two issues the same.
Councillor Green.
So it's just a point actually. So this obviously came through our committee, you know, through experiences that, you know, other councillors had experienced in their life, and also through experiences they gathered through speaking to their residents. And I think just for this committee, one of the things I think this is a brilliant committee. It's my favourite committee, and you know, I think because it actually does so much, and I think it's a credit also to Chorley Council that, you know, they took this on board and really put a lot of effort in as well to get the report and the recommendations on it. But I just sometimes, you know, when people say, oh well, what do you do as a councillor? You know, this is one of those things that, you know, sort of sometimes a bit under the radar, that you can actually make a big difference in through a committee like this. And I think when we had I was fortunate to be you know, would be interviewed by when we had the local government association came in, and you know, some of the stuff the committee does was recognised, you know, and I think it just sometimes I just want to just pat us on the back a little bit. So, you know, it's a really good bit of work that's come out from what we've done. Just shows the power of this committee actually. So there you go. Thank you. Just make the point.
Yeah. Thank you again, Councillor France. If nobody has any further questions or comments, is everyone happy to just note the report? Thank you, that is noted. Let's move on to item 9, Overview and Scrutiny Work Programme for 26-27. The committee is asked to review its proposed work programme and the committee action monitoring tracker. Are there any comments or questions on the proposed work programme? Councillor Molyneux.
Don't worry, nobody can pronounce it. I used to get notes at school that said, "Dear Mr. Teacher," so don't worry. It's coming out of when we had the community safety information. Chief Inspector Neil came and he said he was going to follow up in Adlington and Anderton responses about illegal drugs, and I wondered if there had been anything of that, because I've not heard anything within the village. And he also said about looking if there was an appetite for packed police and communities together meetings in the village, and I would say there's nothing much happened with that either. So I was wondering if Claire. Thank you.
Thank you. Claire's going to answer this for us.
Thank you. Yes, I had been chasing up Chief Inspector Neil following the last meeting, but I believe that he's moved on, or is about to move on in his post. So I will be chasing up the new post holder on those actions.
Well, to go, I have a feeling that Adlington Town Council will be attacking it as well. So perhaps if we have a two-pronged attack, we might get somewhere. But yeah, okay. That's the problem half the time with this, that people move on and they don't keep you updated. And if they did, it would make life much easier.
Councillor Green.
Just on the point June mentioned there, could you provide us with the new contact details for the new Chief Inspector, especially email? Because yeah, because I find it quite effective to email him directly, and that's sort of made things happen. So if you could have that detail sent out to all the councillors, other councillors as well, that'd be useful. So yeah, thanks.
Does anyone else have any comments or questions? Councillor France.
Thank you, Chair. Just going back to June's point about Piked, one of the things myself and Kim found out, our ones were very poorly attended. I used to laugh and say it's police and councillors together. because it was me and Kim, the police officers. So that was my joke. So I think that's one of the reasons. But yes, we certainly found them useful.
Can I come back on? It's just that we don't seem to be getting any kind of conversation whatsoever to say whether there is kind of a feeling for pact, because there are a lot of issues within the village that we know of, and that perhaps some people don't contact the police because they think it's a waste of time, and we need to get over that. And perhaps a meeting and actually face to face is something that is needed.
Yeah, I understand your point. Does anyone else have any comments or questions they want to raise? No. Then the report also asks us to agree the topic for the next scrutiny task group and its membership. This will commence following the current task group's completion. There are 3 proposed topics, which are NEETs, so not in education or training, not in education, employment or training, I need to miss something out, women's safety and misogyny, and unadopted streets. Does anybody have any other suggestions you'd like to bring forward? Councillor Singh?
Just a suggestion I'd like to bring forward to the group is where we look at more in terms of the customer services side of Chorley Council, so in terms of the telephone reaction time, picking up the phone, looking at obviously, because that's what people, if they've got a gripe with Chorley Council, they need something sorted, they're going to speak to the social services, customer services team first, whether that's in person, whether they need an appointment to go into, whether they need some officer's advice. If we can make that better for people, then we're making it better for our residents. So that's my proposal, to bring that forward if that's eligible.
Yeah, Councillor Green?
Just come back to AJ's point. I think it's a really good point. My thoughts on that, though, whether it would be sufficient for a working group or task force group. I think the other 3 that have been proposed, there's more meat on that, but the but is that I just wonder whether we could do that as a bit of a focus through one of these committee meetings where we call the key people from that, and then we drill down. I think we could do that through a focused meeting rather than a task group, because a task group obviously it's over a number of weeks, months, with a number of different engagements inside of things. So I think the task force would be better used for those 3 that have been proposed, but I do think we should do something on that, because I do think it's an important thing, and do it through like I say, a focused meeting through one of these first forums. So that's my thought on that.
I get you there, Ross, and I would accept it, obviously, if it came to an overview scrutiny meeting, where if there's one dedicated to it or something, we can understand and we can put solid recommendations forward and then get a regular update, if that's okay, on that one.
Fabulous. Does anyone have any comments or ideas of which group we'd like to move forward with? Councillor Snape?
Sorry, I wasn't at the workplace planning session, but just to add another suggestion into the mix, and it doesn't have to be for a specific task group, it could be for a spotlight. I did suggest, I think it was 3/4 of the way through the last year, about scrutinising the, I don't know what the proper word is, but I suppose it's discretionary funding that the council gives to, the likes of, I'm naming specifics, but some of the partner organisations like Chorley Buddies, Citizens Advice, Home Start, things like that. I know that's quite I think it comes under a certain umbrella under Bernie Hegarty, because I think they're all doing amazing work, and I think we're very lucky that Chorley Council supports so many organisations like that. But I think some are meeting targets and expectations more than others. I think some, perhaps without, I think some could be a bit more self-sustainable than others. I think some need more help than others than what they're getting. And I think some putting it bluntly, see it as a bit of a cash cow, and don't, because they're reliant on it, they don't then go and make themselves more sustainable through other means like other groups do. Yeah. And I think last time I asked Bernie, I think there's something like 32 organisations or something, varying in sizes, that he oversees. Does he have the capacity to oversee how they're performing? You know, who does the checks and balances? I know there's been issues raised with one or two of those groups and stuff in the past. I just wonder if that's worth chucking into the mix. I'm not saying that they're not doing a good job, but I just think they're getting a lot of money, and where's the transparency in terms of what they're doing and not doing? Thanks.
Yeah, I think that's definitely something that needs raising and needs looking into if it's concerns that we've got. What do other members think? What would they like to go through with? Councillor Green?
Yeah, so I guess same as with, just mentioned about AJ's one. You could do both of those like a spotlight. So that's a nice, it's not the same amount of effort and detail that, but you could just do a spotlight and drill down. So I do think sometimes that just they're quite key. They're really important when we get these organisations to come in. We spent a lot of time as councillors, like saying, this is what our residents are telling us, and this is what we draw up plans and say to like Burnley, right, we need an organisation to deliver this. And then if they don't deliver it, sort of again, it comes back on us and flexes us as a council and also as a council. I do think it's really important that these organisations, when they do it, they really do what we need them to do. So I think that's quite a good one to actually do. And again, I think we could do that through like you said, a spotlight. I think that'd be a good thing to do.
Councillor Brown?
Thank you. So I understand all of these options that we're looking at. The one that Councillor Snape's just mentioned, I do wonder as we go into LGR whether there's something about an initial baseline piece of currently looking at what we do fund and how long that's been funded for, and whether there are terms of reference around that, just even because if you had a group, you're going to have to start with that anyway. And I wonder if there's a bit of tasking somebody to do that, because as we move into LGR and whatever that looks like, there's going to be a compare and contrast piece, isn't there, about what other provision there is and what's being funded. I do agree about the one that Councillor Singh's mentioned, but to do it as within a group itself, again, working with shared services, so we know that we've already got comparative data with South Ribble and what that's looking like. And we compare favourably against most of it, but the data we have been seeing isn't as drilled down. So I do think a bit more drilled down within that would be good to see it. We could probably do that within a session. The two key ones for me out of the three that are there initially are the NEETs one, because we have talked about that for a long time and we know we do have an issue with NEETs. And then the unadopted roads one, which I think is a looming problem that we've got, and certainly in Clayton West, where we have a lot of new builds now, I think this one is going to really hit if we don't have a baseline of what this looks like in terms of adopted roads and the impact on our residents now, and how we work with LCC to understand when that happens. So I do think, for me, those are the two, and there's other ways of maybe doing the other ones.
Councillor Green?
So I mean, all three proposals. I mean, obviously for me, I'm a bit biased from the adopted road side of things, and Buckshot, it's biting us on the backside all the time. It's a bane in my life. I didn't know that Councillor Pillinger for South Ribble was trying to do something through the South Ribble side of things. I don't know whether, because I've not seen anything where we've done a joint scrutiny between South Ribble and Chorley, whether we could add a bit more power on to that as well. If they're looking to propose to do something on the South Ribble, given that we're sort of a joint effectively through Chorley, whether we could even do something joint with that, whether they run it as a main project with us providing input, or whoever. But just again, something for the council to look at. I think it's something there. That one would be a cross council working one. Would work. I think I'd add more weight to it.
Councillor Snape?
I was just going to say, I think if we do go down the unadopted roads route, we did do a task group probably about 10 years ago on it, which is a long time ago, but there were some really important recommendations. So I think it would be really important to make sure that as a starting point that those were sort of dug off the shelf and looked at to see are we adhering to those, because I think at the time, I think it was chaired by Matthew Crowe at the time, we did find that a lot of the stuff we asked for was like national stuff that we wanted to, in terms of procedures and policies and stuff that we wanted to drive nationally, and I think secondarily it was capacity at the county council, because the county council don't proactively chase developers to get their estates adopted, unless the developer comes forward and says, you know, we want a conversation with you. You've basically got to bang their heads together to get them to talk to each other, and I don't think that's changed. But yeah, anyway, those are my thoughts.
Councillor Molyneux, I'm sorry, say it to me again.
Molyneux.
Molyneux.
EAUXO. I would agree. We did do the adoptions one, and some good work came out of it. And a lot of the work we found out, it's not us alone that have all these issues. It was countrywide. So that would be a good starting point to do. I think NEETs is very important to do. I think we need to do that. We've been banging on about it for years, but we've not done anything, and I think we need to. I think that's something we need to do. And I also think we do need to look at some of our partners, because I know some perform better than others. And for some, we're getting really good value for money, but others I'm not too sure of. And I think that needs to be looked at.
Yeah. Councillor Cash, do you want to?
Thank you, Chair. I have read that report from just over 10 years ago on Adopted Road, just before Christmas last year, and it's full of really good recommendations. But I would struggle to evidence that like many times, you know, have come from academia, great reports are written, and then actually operationalising them is another thing altogether. It is a national issue, and there are the government is at the moment looking at some of the recommendations from the Customer Markets Authority and the House Building Federation. You know, in my part of Chorley, there are estates that were built over 20 years ago that still have not been adopted. Yeah. So, you know, that the lack of regulatory framework around it is, while it doesn't seem very sort of, you know, a vital thing like women's safety, there it is for a lot of residents. They have this double whammy of they're paying council tax and they're paying for private management arrangements. So there is a sort of rip-off that our residents are experiencing that I think is certainly the number one outrage issue in Chorley South West. So I think that was a very important one in many ways, although the other ones are much more social justice, and my heart goes to those two. And as a kind of point of information, is there a limited number? Is it capacity that limits our number? Are we jockeying for what our priorities are?
Darren will answer that for us.
Thank you.
Chair, generally you do one review at a time, but just hearing the discussion tonight, and Councillor Green is right that South Ribble are going to be doing a review of NEETs themselves. I'm sure that they would be happy to do a joint review with the Chorley Committee if you wished, and obviously they would need to agree that that is being resourced from an officer point of view. So you could, if you were minded to, do a review of NEETs and set up you know, some members to join and do a joint one with South Ribble, and then also do one at the same time on unadopted roads. So that is an option if you wish to pursue that, if members were minded to tonight.
Thank you. Councillor Green.
So, Chair, just quick on to come back down on that one. So I thought they were doing one on unadopted roads as well. I think Pete Pillinger was going to propose to do one on adopted roads. So whether it's two, they're going to do NEETs and that. So there's opportunities to do, whether we could save time and effort by killing two of those birds through a joint route on that one. The other one I did think though is that just thinking there, obviously we've got with roads, obviously Lancashire County Council's responsibility, and what Kim said about trying to bang again. I've been trying to get them to adopt roads. Maybe just thinking with a local government review coming when it comes into place, whether there may be more power and more influence delaying that one to when local government comes in, or whether we could something, I don't know, whether we could chest to whether in the future organisation that we do that one, because I'm just thinking, given the time that Chorley Council's got, we've got 2 years to do something. I see on the NEETs something we can get something out from NEETs that we as a council can enact, and then on the misogyny and the women's safety, again, I think that's something we could get out of that, something we could enact now over these next 2 years as a council. Whereas I think if we went down the route, and I propose to do this stuff on the road side of things, it is biting my back, so whether we end up doing a report and then we're just sort of sitting on the shelf for another organisation to eventually do something. So I think if I was going to push something, given the time we've got left as a council to do something, I would go for the women and the needs. But whether even if we could do some part, start doing something on road adoption through a joint one, just to get it going, and then maybe we could advise for the next next local government, whoever it is, for them to say, does something your oversight community to take a committee to take on. So that's just my thoughts on it.
Councillor Brown.
Thank you. I think doing NEETs in joint with South Ribble is an excellent idea, given that Runcher College will be part of that, I assume, and obviously covers teenagers and young adults around, well and older, around this whole area. So I think that makes sense, as long as we can still use part of that to localise it where we need to, where we've got specific issues. I'm going to counter what you say on the unadopted roads thing. I understand what you're saying there, but I actually think it's hard enough to get the information now. And once we get into LGR, it's going to be damned harder trying to get information on our local areas. Once we go into a bigger organisation, unless we get a foothold on it now, that's my view. I think it'll just end up in a murky world of we'll get nothing.
Councillor Hayden.
Yeah, on the needs, it's not just about when they actually become neat. It's picking them up about 2 years before. If they're going to, because the teachers and people who work with them know that they are going to be neats in 2 years' time because of what the pattern of behaviour has been throughout the school life. So it's not just the colleges, it's actually the secondary schools as well, which will need to be. And I know the Chorley and district secondary schools, they meet regularly, the headmasters, and discuss about the needs and have their input into it. So, and I remember the first time I heard about needs is when I went to work in the Department for Work and Pensions and worked for Job Centre Plus, and they were tackling needs, and I'm going back to the 90s, and it's like.
Councillor Green.
Well, in terms of resources, though, I mean, to me, ideally, if we could do all three, it'd be brilliant. Because but if we're doing the needs one through South Ribble, I know you're doubling up with some of the officers as well. But whether that would minimise the workload, and then I would leave us 2 to do in the year. We're looking at sort of 3 to 6 months. I mean, the one we're doing a report on now, that's going to be over about 5 months. But again, I think as part of that was because of the fact we had the election in between with it. But if you'd have 12 months, whether we could have, those 2 detailed ones on roads and women's, and misogyny, did those 2 ones, and then the other one was sort of run jointly, whether the workload would be all right, manageable. Again, it's looking to you, Dan. If you could do all 3, I'd love to do all 3.
From an officer perspective, we would be very happy to support that, and obviously members do the bulk of the work in the meetings and things. But as long as you're comfortable, we'll support that.
Yeah, so we can do. Could we do so? So basically, you're saying the scope for us to do all 3, then, isn't it? Is that what you're saying there?
In this work programme year, yes. So I believe that the neurodiversity one's due to end at the end of September. Then you would start your first review then. Yeah. So if you could decide tonight which one of the 2 you would like to do and to have volunteers, that would be great.
What about the community one? Partners?
Spotlight.
Have we agreed on the community partners? Spotlight.
Yeah,
Thank you.
Yes, a spotlight is different to a task group, isn't it? So, just for my clarity as well, is the confirmation that we can do a NEETs one in partnership with South Ribble, so that we don't really need to discuss it any further.
Volunteers,
okay.
Either tonight or outside the meeting.
Okay. Whilst we're here, does anyone want to put themselves forward for that?
I'd like to do that one. NEETs, yeah.
Chair, that's really good. We've got so many volunteers. We might have to discuss how many with South Ribble you would want, because you won't want the job, won't want the group too big. Yeah, sure. But it's great to have the volunteers, and we'll be in touch around setting that needs one up as a joint one with South Ribble.
Fabulous, thank you. So is what we now need to decide whether we're doing unadopted roads or women's safety, or is the unadopted roads also in partnership with South Ribble?
South Ribble has agreed its work programme and unadopted road hasn't formed part of it yet, but the scrutiny chair at South Ribble might be putting it forward, but that's not been agreed yet. So I think the next decision is which review you would like to do after neurodiversity. So is it unadopted roads or the women's safety one? That would be a good, and then whichever task group you're setting up first, if we could have volunteers for that, that'd be great.
Should we take it to a vote, or does anybody have any more discussions? I'm conscious we might be here all night discussing this. Does everybody have to go to a vote, or does anyone want to say anything else right now? Who would like to go with the unadopted roads? I just decided then.
You're not supposed to do that.
Thank you. And do we have any members who would want to sit on that task group?
Sorry?
To sit on the task group, would you like to be on it, a member of it?
Sorry.
Task group.
On what?
Task group.
On the unadopted road task group.
Oh, we're covering another topic then, sorry.
Thank you.
I think I missed that. We get the needs to run the unadopted roads. Get the needs off the needs and then the roads might be right.
So is everyone happy to note the committee work programme and action monitoring tracker as well? Yeah. Thank you. So is everybody happy to note that? Would that be the correct terminology? Excellent, thank you, that's noted. We'll now move on to item number 10, update from the Scrutiny Task and Finish Group, understanding and supporting neurodivergent people, with Councillor Ross, who will give us a verbal update.
Thanks, Chair. So we've had a number of meetings since I last gave an update, and progress has been really good, actually. I'll just, first of all, just say the support from Claire and Alice and Caroline has been absolutely superb from an officer's point of view. They've been really, really good. I mean, Alice has been outstanding in terms of the work she's done as well. So just from my point of view, just want to put on record the fantastic support we've had. So just one thing I just want to, I've seen people say about, things like, what we want to get out from this. And one of the things is that the whole point with this is it's not about, it's not about trying to give somebody advantage at somebody else's expense. The whole point of this exercise is to give everybody a level playing field, and we can maximise the potential and also the strengths that neurodiversity brings with it as well. So quite often the focus is on, I'm dyslexic, and people say, you get your B's and D's wrong, mixed round and all that sort of stuff. So I'll tell you what, you can have some you get some different colour card and all that sort of stuff to help you read, and then you can have there's the read aloud on Microsoft Word will help you, like. But then there's also the other things is that that people who are dyslexic often have clear visions and see big pictures things, and it's trying to get people to recognise that. So it's not just helping people maximise and to make allowances for people that's actually getting the best out of them. So in terms of the meetings we've had so far, we've had a number of stakeholders from the Chorley Council came in, where the various officers came and talked about what do they do and how they try and maximise and benefit the staff and also the general public. So we had a number of groups coming out of that, which was really good. And then for the members also gave some feedback and said, have you thought about this? So just going back to customer relations, which you mentioned, AJ, one of the things that they've been doing stress testing of the telephone call systems and stuff like that, and going through it. And then one of the rest we said was, have you actually considered getting somebody who's neurodiverse to actually do stress tests? And they went, we haven't. So there was little bits and bobs that it sort of already came out from that discussion. One of the most powerful things we also had, we had a volunteer that said they'd like to come and talk about their story, their lived experience, actually. And it was really, really powerful. And the woman that came and talked to us, she struggled. She had problems, performance and everything. And potentially, you could have seen a situation where you know, if nobody sort of supported or helped her, she could have been ended up leaving and being sort of managed out the council. But actually, fortunately, she had a superb line manager that recognised, you know, I think there's some issues here that, you know, that potentially, you know, diverse issues. And she was able to provide support and help and guidance to this employee and made some simple allowances for this employee. And they've shone and really grown. And as a result, they're getting massive amount of efficiency and benefit and work from this woman. It just showed the power, to me, it showed the power of that, you know, by doing this is actually getting the best out of people. So that was really, really quite powerful for us. And then in addition to that, Alice produced a survey that went out to all councillors and employees and also senior management as well. And that's provided some really good oversight of how people felt about things and what they could, what support they felt they could, and also people's understanding of what they thought and did, and clear stuff that came out of that. I think there's some recommendations I think will come out from it in terms of increased training to enable people to get a basic understanding. Not that you're going to become an expert on dyslexia or dyspraxia or anything like that, but some little bit of understand some traits and going, do you know what, maybe there might be, and I can go in to get some advice for my employees to try and help that through. So I think so far it's been really quite powerful actually, and I think we're going to get some really good recommendations out of that. So we've got coming up, we've got a workshop. We've started to identify some external organisations. We did try to focus on getting organisations that were local to Chorley, so we could, you know, going forward, call upon their services. We've got a meeting on the 20th. Well, we've got a workshop, haven't we, with on the 28th of July, where we're getting these external organisations to come in. We've got a meeting next week where we're going to talk about some questions to be able to guide them and trying to soak as much information out of those organisations as we can, and hopefully they can give us some further food for thought in terms of what we can do and build on that going forward. And there's other recommendations that for us to push on and get some increased accreditation for what we've done. On the back of this work, I think there's an opportunity for us to get additional accreditations from a you know, diversity and disability point of view, which you know, we've recommended to try and put there. But yeah, so far it's been a really busy task group. It's really, to be honest, it's been really positive to be able to do so. Yeah, hopefully looking forward to. So when it's all distilled down and we can start getting all these recommendations coming out, we're looking forward to giving a follow-up brief about that there. But again, it's a privilege to be able to do. That's why I enjoyed this committee. I think it's a really good, and also the support we've had from the other councils as well has been superb. So yeah, thanks very much for that, Chair.
Thank you. Does anyone have any questions or comments? No? Well, I thought that was a really interesting report. Thank you very much. I'm looking forward to seeing where it goes.
I'm quite happy for people to drop in sessions, you know, because I said, you know, we've got a core of people that are there, but I've had a couple of councillors saying, I'm in the building, would you mind if I come along? Me personally, I've got no issues with people coming in and just, you know, listening or having 2 pennies worth, just, you know, without having to get you ticked for not, you know, if you can't make all the meetings, but I'm quite happy for other people to rock up and provide 2 pennies worth if they're around. So yeah.
That's great. Thank you very much. Is everybody happy to note these updates? Thank you. That's noted. Item 13. She says. Item 11. Let me go from item 10 to item 13. As long as I've not missed 2 pages, that's fine. Item 13. Any urgent business? What's item 11? Sorry. I've received no urgent business, so thank you everybody for attending, and I now declare this meeting closed.